Meningococcal meningitis is the inflammation of the meninges, the protective layer around the brain caused by meningococcal bacteria. Some of you mightn't have ever heard of meningococcal meningitis before, and that's precisely the reason I'm here to talk to you all today. You see, at first, symptoms resemble that of the flu, but if you brush these symptoms off and try and ignore them thinking it's the flu, you're in for a bit of a surprise. Time is of the essence with this infection. Late diagnosis means late treatment, and you're likely to have long-term neurological consequences in that case. Not a really good thing. Hi, my name is Neisseria meningitis. Yep, I am the bacteria that causes meningococcal meningitis. Here's what I look like on a gram stain. I'm pink because I'm what they call a gram-negative bacteria, but we don't really have to talk about that because it's not very relevant. Transition for me is pretty hard from host to host because I don't really survive long outside the host cell, so it has to be pretty much a swapping of bodily fluids, otherwise I'm toast. Bad. I currently live in 10% of the population within the nasopharynx, without any of them showing any illness whatsoever. I like to think of us as having a sort of symbiotic relationship, you know? Like Venom, but instead of giving you godly superpowers, I give you my company. Once I enter the human body, I begin the first step called colonization. In this step, your body produces immunoglobulin A, an antibody meant to kill me. In turn, I produce IgA protease, which renders your immunoglobulin A pretty useless. Next step is invasion. Here, I'll show you a photo of me, and you can see those little hair-like structures coming out. Those are called pili. What they help me do is adhere to and migrate through your body's epithelial cells. This is usually as far as I go in most people, like I said, in that 10%. To progress further, usually the host will have some risk factors. They will be immunocompromised, for example, someone having HIV/AIDS. They could be a smoker or a second-hand smoker even, or they've made contact with an infected person. Truth is, scientists still don't really know why in some people I progress further than others. And so it's probably better to be safe than sorry. Anyways, if you're lucky enough to progress further, the next step is immune evasion. This is where I go to war with your body's neutrophils, a white blood cell. A neutrophil engulfs me, puts me in something called a phagosome. Within there, it tries to release hydrogen peroxide, meant to kill me. I release catalase. What does catalase do? Turns that treasured hydrogen peroxide into water and oxygen. Harmless. Now that I'm in the cell, I use all of its nutrients and rapidly multiply till the cell bursts and boom, I'm in the bloodstream. Within the bloodstream, I easily make my way to the CSF and into the meninges. Hence, meningococcal meningitis. In the meninges, I enter and infect the subarachnoid space. I inflame the meninges, and luckily for you, meninges are pain sensitive, so you feel all of this. If you have meningococcal meningitis, at first, you will have a headache, fever, and general discomfort. Like I said, very flu-like symptoms. Easy to get them confused. Next, you'll have a stiff neck, photophobia, and phonophobia, which means extreme sensitivity to light and sound respectively, and you feel nauseous, you'll vomit. So, you think you might have meningococcal meningitis. What do? You go to your doctor. If your doctor suspects you may have it, they'll undergo two procedures, one called Koenig's sign and the other called Brudzinski's sign. Koenig sign has you lay flat on your back, lift your left leg up and flex it to 45 degrees, and the doctor will attempt to extend your leg. If there is any involuntary resistance onto that leg, onto the extension, it's an indication that you have meningitis. Brudzinski sign, very similar. You lay flat on your back, the doctor will place their hand under your head and lift your head up. If your hips and knees flex as a result of this, it's a very good indication that you have meningitis. Okay, so if your doctor suspects you may have meningococcal meningitis, you're likely to undergo a lumbar puncture. A very painful thing. So, a lumbar puncture involves the use of a big needle, your back, and CSF. The needle is inserted into your back, extracts a certain amount of CSF to analyze. What we want to look at here is the white blood cell count. As you can see, there's more than 1,000 white blood cells per cubed millimeter. That's a lot when you consider that the average is only 5. White blood cell count is the main indication that you have meningitis. So, you have meningitis, what's the treatment? Steroids? Yep, you take steroids for the inflammation. And broad spectrum antibiotics. I am a bacteria, antibiotics aren't very nice to me. They make me sad. And you know what else makes me sad? The fact that if I infect you, one of us is going to kill each other. So as much as I love our company and our time together, I'd prefer it that you didn't get a chance to get infected by me in the first place, and no death. This involves a vaccine and prophylaxis. Prophylaxis means taking antibiotics if someone you know and have close contact with has meningitis. A vaccine, there's a vaccine for every strain of meningococcal meningitis in Australia right now. There really isn't any excuse for you not to have it. And remember, every 5 years, you'll likely need a new vaccine. And what's the moral of the story? Get vaccinated, kids.